you go, it's the same sound, money worries. But are we there again? With these latest restrictions, will people find themselves in or with money worries? Well, here to discuss the latest lockdown measures with us is former Minister in the Minister of Finance, Mariana Brown. Good morning to you, Mr. Brown.
Good morning.
And how are you doing?
I'm quite fine, thank you.
So I think the question on everybody's mind this morning is, can Trinidad and Tobago afford financially, economically, to be in another lockdown?
Well, the answer to that is I think everybody is under a bit of strain, and there are some sectors which are under more strain than others, particularly, you can say, the hospitality sector. Those people who interact with one another on a daily basis. Now, they are the lower end of the market, lower income levels.
Yeah.
And the closure means that they are going to be in difficulties because those businesses have to return to full operations, and by definition, therefore, whether the company or the companies which operate those restaurants are going to be able to maintain or keep them or keep paying them for the period of which they're out is an issue. Now, some are going to be able to do so, and some are not going to be able to do so. So it's going to be a mixed bag. The other question, I think, is whether, like in other countries, we will start getting lockdown fatigue. That's a possibility as well. We haven't had COVID in the sense that it's in your face and it has hurt you. Our case is under distress. Some questions to how deep is the issue and how much we are affected. So I think that credibility is going to be an issue moving forward. And we have to start talking about how we're going to live with it, because this is not going to be the evidence from all the other countries is this is not a one-year affair anymore. We've passed the 1 year, right? We're into the second year. And rather than seeing it come under control, what we're seeing is that it's expanding and or returning. So the issue is going to be from now onwards, what do we do to live with it? And how do we live with it? Because we can't continue starting work on an ongoing basis. That can't happen forever. People get impatient. And I think 3 weeks is fine, but anything longer than that is likely to see some impatience.
Right, but the reality is that what if in the 3 weeks we don't have the kind of numbers, less numbers, more controlled numbers as we were enjoying before?
Well, so far the evidence suggests that the population has been quite patient. By and large, I mean, there have had pockets of which people have been rebelled, but by and large, I think that the population has fallen in line. So the point is that if this keeps happening and we stop starting and so on, at some point, at some stage in the game, people are going to say, well, okay, we've had enough of this now. That's one. And the other matter is that if we keep the borders locked down, the question has to be, well, how is it spreading? Right? Is it just simply one person who's being repatriated? Because our control policy has been literally to keep nationals who've been abroad, leave them abroad. Particularly those, we don't have a policy which says, for example, that we're giving priority to those who coming from countries where there's limited evidence of COVID or anything along those lines. In fact, the criteria, it has been a big complaint about what the criteria has been. Say, for example, that a national came in and he has a new strain, a new virus. Are all the cases as a result of the one person that came in, or is it this is also some level of community spread which is taking place?
Well, I don't think we can doubt if there is some level of whether they want to call it sporadic community spread. With the medical people, you have to be so careful about what terminology you use. I don't want to use the wrong one. But the reality is that, the people coming from abroad, they have to quarantine. So I don't know that we could automatically say that's where it's coming from. But even outside of that, we have been having cases in the society, just not the kind of numbers we're seeing. So
yes,
then we have...
And I accept that, and that would be normal.
Yeah.
So the point I'm making, first of all, to a lockdown, this lockdown, is 3 weeks going to be enough? As I'm making the point that if people's livelihoods are being affected, we're talking about the ability to put food on the table. And in your little talk before, the government has already said, well, look, it doesn't have any more money to give anybody any support. And the argument has been, and for many people who figure that they're entitled to support, where we really haven't gotten support, right? So that that's why I'm saying lockdown fatigue. We're going to get to the stage people have to get on. They have to get on with life.
But, you know, Mariano, when we look at this, the thing is, what else can the government do? Because this is something we see right across the world. When the numbers get out of control, the government's going to lockdown measure to try to curtail the spread of the virus.
Well, and to that extent, we've been proactive. I don't think our numbers have never been out of control. We've always been very much in control, and the hardening of the borders and how we keep people out and so on has always raised some questions. So the point is this. If we aren't as badly affected, I think that's generally the case. That's one of the reasons why people, you would have an element that is a little skeptical about what's going on. If everybody gets along and goes along with the plan, generally they fall in line. But I'm saying if we continue to do this, and the healthcare system is not under pressure, people are going to start asking some questions about why are we doing it on an ongoing basis. And at some stage, you have to make a choice. Right?
Yeah, but
the father has to go to the water to drink water. The lions may be there, but they still have to drink water.
But we know that the same people who will get frustrated now are the exact people who will say, why didn't the government do this and why did they allow it to come out of control? Because I don't know that we can say at this point that, you know, we're not having spread because we didn't do these measures. If there's no correlation between the measures that were taken and the numbers that we've enjoyed. I don't know that if we were to leave everything open, that we would have been enjoying this kind of control as you suggested.
Well, we don't know the answer to that. And the country has bordered on taking the necessary steps in advance. We don't want it to get to that situation. I'm just simply making the point that if we keep doing this, people are going to be affected, and we need to manage, and you're going to get a little pushback.
I wouldn't doubt that. But
I'm not saying that government is wrong to do it.
Right.
I'm saying that in these things there's a balance, and we may be reaching the point where that balance is being stretched.
But what do we do? What do we do? How do we fix it? What do we say to the people? Because if we're having spread, it's because at some point we're having those levels of interaction that allows the COVID-19 to move from one person to the other.
Yes, I accept that. Government is in a difficult position. It has to be responsible, right? But it also has and you have to be responsible wearing two hats. You have to be responsible in the sense for healthcare, but you also have to be responsible in the sense that people need to move on with life, and they have to work to earn a living. And there are these people who, all right, take for example, what do you say to the restaurant and say, okay, good, you're telling me to close, but you're leaving the church open. What is it that COVID doesn't go to church?
Right.
How do you answer that? And that's you can say that they're taking certain types of measures, but there's some measures that just don't stack up.
I think what we've heard from the when we have those press conferences, that why they always go with the in-house dining and those kind of things is for the restaurants, the cinemas and stuff, is that you have to remove your mask. You have to remove your mask, and therefore the exposure might be greater because the masks work in curtailing the virus. So I think for that I can understand that particular measure.
Yeah, well, I'm sure that there's a rational explanation. I'm just simply saying that I understand that government is in a difficult position, and I understand that government must take all steps that it considers responsible to get and to control the spread of the virus, right? Consistent with what we consider to be scientific guidelines. I'm saying that in the same token, right, this is an economically different situation. Yeah. The economy was already in distress. By having COVID-19, we've added to the difficulty. And having added to the difficulty, there are some people who have reached the point where they say, well, look, we need to make money. This is what we have to do. And they are going to make those choices. That's all I'm saying.
Yeah.
And I'm saying that there's a balance now in terms of where we are. If it's for 3 weeks and people can take it, take the pressure, then that's positive. There may come a time where people are going to say, okay, we've had enough of that and we move onwards. I'm saying that we're getting to that point.
Yes, I understand perfectly what you're saying, but in terms of treating with it, as you said, it is really a balancing act. If you had to treat with it, what do you think you would do differently? Because as you said, we were in an economic crunch even before COVID-19. So the government's ability to extend itself to the population in terms of the grants obviously would have already been a difficult, they would have already been in a difficult position, and we saw the borrowing. We saw how that would affect the debt to GDP ratio. So really, how else can the government treat with this?
Well, debt to GDP ratio is really two components, foreign debt and domestic debt. The numbers are going to be always out of whack already. The question how much more they're going to be out of whack on the basis of you supporting, helping to support certain sections of the population. The first issue that comes up is that our distribution mechanism has not been robust. In fact, the general consensus is that our institutions, our government institutions, in terms of the distribution mechanism, are not strong and very patchy. And we have to move away from a situation where one favored members will get and the rest wouldn't. If it's going to be equal and everybody has to get, then by definition, you have to basically make a distribution system robust. We didn't do that. That's the first point. The second point is that the amount of money we're talking about from the point of view of relief is not going to do our debt figures any great degree of disservice. All right, that's one. Two, and the third point, not only is it not going to do any degree of disservice, it's also being done in TT dollars, not US dollars. Right, so from a TT dollar perspective, right, if the debt increases, it's much more, it's easier to deal with domestic debt than it is to deal with foreign debt. Domestic debt, there are all different kinds of things that we can do to solve that issue, as the minister has done, for example, with VAT and VAT bonds and everything else. So there are all different kinds of mechanisms that we could use. So I don't buy that argument on the local side. I understand that there may be limitations, right? But at the same token, I still think that there's room for maneuver in that regard, particularly if we're saying this is a priority. You always find room for priorities.
Right. So you think that the government should continue to extend itself to the people who are affected or socially displaced by the pandemic?
Yes, and it has to, and it must improve the mechanisms by which it does so. Right? But I think it can do so.
Right.
And that is an improvement area. You have to improve the distribution mechanism, and you have to do it. If you are going to take those measures, and the third measure that of course that is really a sticking point with everybody, is the issue of leaving your nationals outside. We took a position that we're going to leave our nationals outside, and that was the end of that. Right? At the end of the day, your nationals are your nationals. This is home. You can't tell them they have to ask permission to come home. I find that particularly insulting.
Okay, Mr. Brown, I hear you on that. But let us look at what's going to be happening going forward. We do have vaccines in the country at this time, but the rollout obviously is going to be taking some time based on availability of vaccines, based on how people are coming forward, all of these things. Do you think that support of the people who are displaced by COVID should continue until we get to that herd immunity?
Well, the evidence with regard to vaccines is a little, how shall we call it? We have some issues at this stage. It is about persuading people to take the vaccines and not focusing on the risk factors. So we are a long way from herd immunity, a long way. So and until and unless the world can produce more vaccines and distribute it better, well, we're going to be in this situation for a little while. This is not a one-year exercise, right? This is year 2, right? And there is going to be a year 3 and definitely a year 4, right? Until those vaccines are produced and the vaccine efficacy has been demonstrated, so that we're going to be in these kind of, I guess you could say, stop and start measures, and that's why we're going to have to be more robust in terms of discipline structure, what people do, habits, as distinct from closing it down. You can't stop life, so you have to change your habits, and I think that's where the focus now must be, right? Because we've passed a year, right? So this means this is going to be with us for a little while. So now our habits have to become more rigorous. Our healthcare habits have to become more rigorous.
Do you believe that the people understand that, though, that in all of this, that we have to take some personal responsibility for how we treat with the thing, how we conduct ourselves?
Yes, we keep focusing on the 10% of the population and that doesn't fall into line, right? the 90% of the population is falling into line generally. Right? I think we need to praise them, and I think we need to get them to discipline the 10%. Right? The other day, I I got out of my car. There was nobody in the street. Right? And the fellow on the other side of the street said to me, you didn't put on your mask. So go back inside. It was not that there was anybody. There was nobody. Right? And the evidence now seems to suggest that transmission via surface touching is very low on the totem pole. Right? It's really more the issue of wearing a mask is going to be a critical part of it. In terms of how close you're interacting with people. So it's really a question of changing habits. And I think the country has gotten that. We have to praise them.
But yet we have the numbers going up.
Yes, and they still have numbers going up. So there are a lot of things we don't know about COVID, you know. There are some things we know and some things that we've been paying attention to. The transmission mechanism is still very unclear. For example, we know that if you take the vaccine, it will help you if you get it. Whether it stops the spread is another matter altogether. We don't know that. That's not clear either. So there are a lot of things that we don't know. That's why, in a sense, we have to be cautious. And I understand government's caution. And don't get me wrong. I didn't say that government ought not to control outflow in terms of the population. But I said that. I didn't say that it ought not to consider closure measures or reducing movement. I didn't say that either. I said that we are at a delicate balance, right? And I take your point with regard to personal responsibility. That is something that we have to, how shall we go? We have to continue to ask people to do their share. And I accept that. I think that's a very important message from a communication point of view. But at the same token, I am also saying that it's clear that COVID is going to be here, right? And it's going to be here with us on a continuous basis.
So we have to find other mechanisms to treat with it instead of locking down.
Correct.
All right, Mr. Brown, we do have to leave it there, but thank you so much for speaking with us this morning.
Thank you very much.
You're most welcome. Mariana Brown there talking to us. He says it's not that the government is wrong. It's just that you need this balancing act where you can deal with the health and deal with the economics. But he believes that the government should continue to support the people who have been displaced by COVID-19. We take a break and we'll be back with you.